All right, and welcome. This is Celebrity Pharmacologist, and today let's look at this simple clinical pharmacology question that is on the board. And the question says, a 4-year-old boy develops ear pain and inflammation a few days after accidentally inserting a small object into his ear. He is receiving appropriate treatment for the underlying condition. Which analgesic is the most appropriate to relieve both his pain and inflammation? So looking at this, option A says paracetamol, B says naproxen, D says diclofenac, and D says ibuprofen. Now looking at this question, we are talking of what? A drug that can help for inflammation and pain relief. What actually happened? He said the little boy inserted objects and is receiving what the appropriate treatment for the underlying condition. So what could be the appropriate treatment? Maybe removal of the object first, then giving maybe prophylactic antibiotics or anything, check for pus, check for injury in the ear. So that aside, they said the question said the little boy developed what? Inflammation and what? Pain and inflammation. Now looking at this now, our option A is paracetamol. We know that paracetamol can be used for this, yes, but it is not having enough strength for the anti-inflammatory effect. It's more of analgesic and antipyretic drug. So talking about inflammation, paracetamol is not a complete drug for this. It can be used, but it is not a complete drug for this. So keep it waiting. We'll not take it out yet. Now we have option B says naproxen and D says diclofenac. Sorry, B and C says naproxen and diclofenac. One thing we should also know is that naproxen and diclofenac, they are not routinely used in management of pain in children or in treatment of pain in children. That's why it's very rare when you go to any pharmacy to say, I want to buy diclofenac syrup or I want to buy naproxen suspension. It's very, very rare. They are being used on special conditions under the supervision of pharmacists or licensed medical doctors or medical practitioners. So, because of this, diclofenac and naproxen will not be our answer. Then our answer, the favorite here, is definitely going to be ibuprofen because it is a potent what?